But this has been a great journey of constructing the lab, starting with very initial meeting back in 2020. So पहली meeting में जिसमें हमने ये देखा कि क्या क्या चीज़ें की ज़रूरत है पाकिस्तान में, and it was decided from a number of partners. Janawar actually led secretary, WHO, ministry, and all of the technical people. Wonderful person. Sir, he is the man behind the whole event today. Thank you. And our own agriculture management system, and many technical experts from CDC department as well.
Yes, mostly used nowadays.
Then the construction of the well started. I think the medical experts, electrical engineers, biomedical engineers, put together and these are some pictures, where
This is assembled in the garage.
This is the WHO pre-qualified lab, but it's a state of the art. So thank you so much for your leadership. There was some problem. Mr. Patel actually took right. They are called, secretaries and all those.
भाई जी ने पीछे कर ले थोड़ा सा.
ये पीछे हो गई.
So with your kind permission, may I start? Bismillahirrahmanirrahim. I'm going to start with a reference from Jesus Christ in Quran, and that says, Allahumma Rabbana anzil alayna ma'idatan minas samai takuna lana eidam li'awwalina wa akhirina wa ayatan minka warzuqna wa anta khairur raziqin. So this is a reference from Christ in Quran, and that says, our Lord, send down to us a table full of food from the heavens, to be for us a festival for the current and the generations to come, and a sign from you. And give us the provisions, and you are the best of providers. With this quote from Quran, ladies and gentlemen, on behalf of Excellencies Minister Abdul Qadir Patel Sahab, Ambassador Donald Blome, Honorable Major General Amir Ikram Sahab, Head of the NIH, and myself, we welcome you to our handing over ceremony. I'm highly thankful for your sparing time. Especially, I see Dr. Nisar Ahmed Cheemans, the MNA from Pakistan Muslim League, sir. Dr. Shabnam Sarfraz, a long-term friend, a member from social sector. Secretary Health, Dr. Shabana Salim, and her team, and most importantly, our provincial health secretaries and director generals from all 4 provincials who are sitting there. Also with us are representatives from academia. We have representation from vice chancellors of University of Peshawar, Lahore University, and we are very privileged and honored to have the highest representation from both government side. And I will just walk you through what has been happening in the last 2.5 years, where US government has been collaborating through USAID with government of Pakistan at various levels of COVID support. The first and foremost, I know some of my colleagues who are sitting from the provincial side, they know how important it is, and especially Dr. General Amir, when we were actually trying to struggle, what does it mean for Pakistan to quantify the requirements of personal protection equipment back in February 2020, when the first case actually was identified in Pakistan. So the first and foremost digital help that came from USAID and government of United States was basically to quickly develop a forecasting and quantification tool to quantify the personal protection equipment requirements. The second requirement that came from Jalamir was basically, Tariq, how can we do the inventory management for different equipment that is coming to Pakistan. So in a very short period of time, this tool was not only developed by Pakistan through USAID, but it was then taken up by government of Netherlands. I+ Solution in Netherlands actually took the course that Pakistan developed, and they actually trained more than 534 professionals on quantification tool to the entire world. So I think that's a blessing that came from USAID to government of Pakistan, and government of Pakistan actually helping more than 34 countries around the world in a time that was most needed actually, in terms of response wise. The second thing that came to our attention was, from a government of Pakistan requested, was how can we do a good surveillance for people who are coming at our point of entries, our airports, seaports, and land borders. And that was one thing that we did with Central Health Establishment. and travelers surveillance information system was developed. That means that 1 million people who were traveling were actually, they were done with the surveillance, and they were having that follow-up activity. The next activity was that USAID and Government of Pakistan collaborated was development of a procurement and purchase management system that National Disaster Management Agency has to do, because it was about $600 million that came from World Bank and Asian Development Bank, but we were not very aware as to how we are going to manage hundreds of purchase orders with international and local industry to manage. So that was a first also digital activity that we did for the NCOC and NDMA at that time. I know my very dear colleague from DRAP is sitting here. The next request was how we can automate the Drug Regulatory Authority of Pakistan, and I'm very pleased as a Pakistani, as a bridge between the two governments, that DRAP in Pakistan is the only institution that has been totally automated. All 5 million records from the last 10 years have been on the digital side. At least that was a great development in terms of standardization and ease of business. We also developed an import and export certification system. I know that I'll take a little while, sir, with your permission, but it is, I think, good in terms of how the two governments have been working over the last 2.5 years. And then was the ministry's help. Ministry's request was, that how we can have this, a storage system. The COVID vaccine so far has come like 304 million doses have been procured, and they came to Pakistan. And they're all stored at a warehouse that was ISO certified and WHO pre-qualified back in 2015. So that was a good foundation that actually worked very nicely for COVID vaccines when it became the foundation for the COVID pandemic. We have been able to bring 200 ventilators in Pakistan, and I know Council Generals and provincial ministers and secretaries, they have been doing a wonderful job. Our leadership, Michael Gambas, is sitting here. He has been part of those meetings. And those 200 ventilators increased the capacity to 30%, where COVID patients were given those ventilator facilities across Pakistan. A number of other things, like in air shipments for personal protection equipment, rapid testing kits for point of entries. They were all came in through air flights and seaports, and this was done very nicely. One most important thing was also done, and that was, I'm sure you are familiar with supply chain and logistics, which many companies do, like TCS and others. But less people are familiar with reverse logistics. So there was one condition of the Pfizer and all modern vaccines that was coming to Pakistan, that how Pakistan can do a reverse logistics, taking all those data loggers and vaccine thermal boxes back to the origin, so that they can go back and they can be recycled to supply. So that was done for the very first time in Pakistan, and I'm very thankful to my colleague Dr. Akram Shah, who's sitting here as the EPI, today he's representing government of KB, but it was done very nicely, and we were able to bring 5,700 data loggers back and thermal boxes back to the Pfizer active. We did with USAID an examination of medical and industrial oxygen inequities in Pakistan, because this was a time when NOC was struggling to see how we can actually turn industrial oxygen to medical oxygen, so that our COVID patients can get more oxygen in the hospitals actually. So that assessment was done, and that assessment now Minister Saab is actually translating into 4 shipments that have arrived in Pakistan, and in October, inshallah, all this $7.5 million oxygen equipment will be actually going to ICUs and hospitals of Pakistan. So that's a big thing, again coming from USAID. Many other things. USAID is helping a fleet of cold chain management for trucks, refrigerated trucks. I'm thankful to Dr. Shabana, who recently just signed off. These trucks are coming automated, and electrical equipment is coming for the warehouse, just to make sure that cold chain is working on the wheels very nicely. So that is also coming. In the pipeline, we have, most importantly, we were discussing, General Amir was discussing with our Mr. Reed Ashelham, who is our mission director, the requirement of an infectious disease information system that will change the face of Pakistan's surveillance sector. And that means we have many surveillance systems, but we don't have a real-time information system. So General Amir has been helping into AIDS, TB, malaria, hepatitis, COVID, and all those diseases put onto a foundation, and that foundation will help Pakistan identify epidemics as and when required. Lastly, and most importantly, for the activity that we have been together here, and I'm very thankful with sure for the two governments, but this is something that has been happening for the last 2.5 years. But it has been an effort between the provincial governments, leadership of Dr. Amir, and the provincial governments, who have been working together in terms of identifying the specifications for these labs. Actually, I'm sure Dr. Amir will speak more about this. But these labs is a very great example between the two countries' collaboration on supply chain, where the equipment for the lab was actually purchased in South Africa, Johannesburg. It was shipped in Karachi seaport, Bin Qasim, for 5 containers came here, and then biomedical experts, electrical experts, and other experts actually assembled in Pakistan, and they actually put the lab here in Pakistan. These 4 labs are ready, and they are going to cover the remote parts of the country where epidemic responses will be a great, I think, power of Pakistan as a great example of collaboration between the two countries. With this that I'm talking, I will not talk more about the labs. I'll request General Amir to please come over here and apprise us with his remarks. Sir.
Nelda, definitely she's not around. Dear colleagues, dignitaries, senior colleagues sitting over here. First of all, it's a deep, I would say, privilege for us at NIH to welcome you on this very, very important ceremony, for which definitely we have been trying for a very, very long time. It's a history. We heard a little bit from Dr. Tariq. Now, as we move on, definitely, I think it's the relation between the two countries, with so many things coming together, and NIH definitely providing a big platform as far as the mobile labs are concerned. COVID has been a big challenge, and the story is still not over, but I would like to say definitely that such challenges always bring in opportunities, and it is our duty to convert those challenges and opportunities into realities. And then one of the realities, as you can see, those 4 long 45 feet containers with fully equipped for any detection anywhere within the country. So this talks volumes. This is just one. There are so many other examples that have been set at the national standard. The government of Pakistan, the Ministry of National Health Services Regulation and Coordination, putting in all the efforts together to put a very robust fight against COVID. And definitely with this experience, whatever successes, alhamdulillah, we have had at the national level, will help us in strategizing for the future eventualities. Now, just coming back to this thing, we had discussions with the US government, then moving on with all the preparations. It's been a long story, but for the first time, definitely we made a technical working group as well. We are extremely grateful to experts within the country. Professor Tariq Khadim is sitting over here. Thank you so much, sir. And Professor Shamsul Arfin Kasmi for coming together with a complete manual. And definitely these 4, they are the property of the government of Pakistan, but definitely as we move on, they will be handed over to different provinces. And at the central level, definitely, we will take care of Gilgit-Baltistan and Azad Jammu and Kashmir. So I think putting all the things together, coming down to that level, now as we move on, we'll hand over these vehicles posted to the different provinces as well. And there comes the duty definitely of the authorities, because it's not only the vehicle, but its own safety as well that we are very much keen to look after. So the involvement of the authorities, the administration, and moving on to the law enforcement agencies, taking them into loop, strategizing at the provinces level. So this will help us a lot. We have had experience of one of the mobile vehicles at far-flung areas during COVID, and they performed immaculately. And based upon that experience, I think I would say a very successful and important experience that we have in hand, we'll move on. We are extremely grateful to our minister, so for sparing time for today, and to the ambassador in particular also, that they are here. And as we move on, definitely this will strengthen our mutual relations as well as enhance our capacity of working all across the country. I'm also very much indebted to all the dignitaries sitting over here for coming over and witnessing this very important event. And beyond that, Definitely, as we have already launched the integrated disease surveillance and response system all across the country, for definitely we are also great to again to USAID as well as GSI for establishing the disease surveillance and response units all across the country. But now coming back to, in particular, I think a lot of credit goes to USAID through Demonics. It's been lot of work, frankly speaking, behind this success story. So, Dr. Tariq, to you and to your whole team, we definitely show our gratitude, and I'm sure this will help us further nurture the things at the national level. So, once again, to all the audience, thank you so much for coming here, and very kind of you, sir, to be here and witness it. Thank you so much.
To give his keynote address, Ambassador Donald Blome, please.
Executive Director of the National Institute of Health, Dr. Amr Ikram. Ladies and gentlemen, Assalamu alaikum. Good afternoon. We're here today to celebrate our partnership in combating COVID-19 today by providing to the Ministry of Health these mobile laboratories. And I want to congratulate Minister Patel and the Pakistani government, the National Command and Operations Center, the National Institutes of Health, and especially the frontline health workers for their successful vaccination campaign amid enormous challenges. The doctors, the nurses, the technicians on the front line of combating this pandemic are the real heroes of our time, and it's really our honor to support them in any way we can. The U.S. government has worked side by side with public health officials in Pakistan for more than 6 decades. This partnership has helped strengthen Pakistan's healthcare system by creating infrastructure, training staff, and developing emergency action plans. Our joint efforts to combat COVID-19 have been a model of cooperation, and we intend to build on this effort. The United States is the single largest donor of COVID-19 vaccines to Pakistan, 61 million doses since June of 2020, and we've donated nearly $80 million in COVID-related support to Pakistan, including rapid diagnostic tests, protective equipment, hospital equipment. And these donations, combined with the hard work of Pakistan's dedicated health workers, scientists, and government officials, have saved lives. Throughout the pandemic, reaching rural communities was one of the toughest challenges. Isolated populations without access to high-quality health care are especially vulnerable, and public health officials struggled to reach them with testing, treatment, and vaccinations. That's why I'm pleased to hand over 4 mobile laboratories to the National Institute of Health. These mobile laboratories contain state-of-the-art diagnostic equipment and technology. They'll improve the accuracy of diagnoses and dramatically reduce turnaround times for testing results from days to hours. The pandemic reminded us that while we might all want to be done with the COVID pandemic, COVID is not yet done with us. Today we're seeing spikes in COVID-19 infections around the world, and we must remain vigilant in protecting ourselves and our communities. I'm confident that Minister Patel and his team will use these mobile laboratories to protect the people of Pakistan from the resurgence of the COVID-19 pandemic. Our cooperation to combat COVID-19 is not the first time we've worked together to promote the health and well-being of the Pakistani people. During the 75-year partnership between Pakistan and the United States, we've helped Pakistan expand access to clean drinking water and sanitation services, respond to other infectious diseases such as typhoid fever, and improve the quality of healthcare products available to Pakistani communities. And that commitment continues as we prepare to hold the first U.S.-Pakistan Health Dialogue in Washington later this month. This initiative will seek to deepen ties between the U.S. and Pakistani healthcare sectors and identify opportunities for further work together. Today's donation of the mobile labs is the latest example of our shared commitment to improve the health of the Pakistani people. And I hope it also serves as a sign of the enduring friendship between our two countries. Thank you very much.
For media, and they are requesting that they want to listen me in the Urdu. So आपकी रिक्वेस्ट अपनी जगह पर थोड़ा सा मुझे एक्सीलेंसी का शुक्रिया अदा करने दें. Excellency US Ambassador of Pakistan Mr. Donald Blome, Secretary Health Dr. Mohammad Fakhri Alam Sahab, which is on leave, so उनकी जगह पर डॉक्टर तो नहीं है मेरे ख्याल में, लेकिन हमारे कोकर साहब मौजूद है. एग्जीक्यूटिव डायरेक्टर NIH, वेरी फेमस पर्सन जनरल आमिर इकराम साहब, provincial health secretaries, director generals, vice chancellors, lab focal persons, country directors, communics, Dr. Tarek especially, and his team. Ladies and gentlemen, good afternoon. Sir, COVID has badly impacted the healthcare and economy of Pakistan like many other countries in the world. Since 2020, USAID assisted Pakistan with huge supplies of vaccines, biomedicals, and many other things, equipments, ventilators, PPE, and rapid testing kits. On digital healthcare, we receive border surveillance, procurement, and supply chain system for COVID and other infectious diseases. So time has matched again when COVID is increasing. In the country of, in Pakistan and USAID has come up with the laboratory assistant this unique support in the form of 4 state-of-the-art laboratories on the wheels. Laboratories on the wheels, it's a kind of new thing, I think, in the world. In the Asia, as I know. 50 feet long on Volvo trucks. It's amazing, sir. Sir, my own ministry and Economic Affairs Division have signed the bilateral agreement with USAID for this, and I take full responsibility to ensure appropriate use of the lab here in Islamabad. As I hear, sir, the MOU have been signed between the NIH and provincial health. Provincial health departments, I would request that honorable provincial ministers to take keen interest in the making full use of these laboratories as soon as receive your lab. Make sure it, please. I pledge the government of Pakistan would provide all possible resources to ensure smooth operation of these mobile labs. And lately, I think my friend Ambassador Blome and his entire team at USAID Pakistan and Washington for their commitment and for their commitment with the people of Pakistan. And I'm very thankful, sir. Can I switch with your permission, Excellency? हम सब जिस तरह सारे लोग यहाँ जमा हैं, जिनका मैंने फर्दन तारुफ भी लिया आपके सामने, नाम भी लिए जितने मुझे आते थे या जिन के ले सकता था। हम सारे बहैसियत कौम बहुत शुक्रगुजार हैं USAID के और स्पेशली मिस्टर ब्लोम साहब के, जो अपना कीमती वक्त निकाल कर यहाँ पर आज आए हैं और एक स्टेट ऑफ आर्ट लैब्स ऑन द व्हील उन्होंने पाकिस्तान को अतिया की। इससे पहले भी कोविड के ज़माने में और उसके साथ फिर जितनी भी हमारी नेशनल सतह पे ये एपिडेमिक फैलता गया, तो उसमें USAID का एक बड़ा किरदार रहा, सप्लाई चेन के हवाले से, वैक्सीनेशन के हवाले से। तो आई एम इंश्योर यू सर, वी आर द नेशन विल नेवर forgive, we are not thankless people, sir, and again I will thank you for this. हम कुछ तब्दीलियां मजीद भी लाने जा रहे हैं, मैं इस मौके का फायदा उठाऊंगा। Sir, we are going to revamp, and what would you say, any suitable word, revamp or value add or making new our border health system, which is very important. There was a department when I came that called Central Establishment, and there was short name was CHI. So we are going to change this name with Border Health Services, BHS, and we are going to connect that entry and exit point data with NADRA. Every person who is coming to the Pakistan and living in Pakistan, he would be registered as he is vaccinated by COVID, he is vaccinated by yellow fever, and he is vaccinated by polio, at least 3 initially stage. We are doing this, and the Prime Minister of Pakistan, I am thankful to Mr. Shahbaz Sharif Sahab. He approved over this proposal, and we are rapidly moving on that. As His Excellency mentioned, in the end of this month, there is US Health Dialogue. So, sir, we are taking it very seriously, and I am leading myself, my team, to the US for this very special dialogue, and inshallah that will be very fruitful result of this dialogue. And once again, ladies and gentlemen, I am thankful to you, especially His Excellency Mr. Blome and all others, and Dr. Tariq Saab, and my NIH hero, Amir Ikram Saab, and other guests. Thank you very much. बहुत शुक्रिया. अस्सलाम वालेकुम.
सर बहुत शुक्रिया, थैंक यू सो मच. और आप यकीन कीजिए जब मेरी
बैठे यार कैमरा